The Atlas of Heart Disease and Stroke is a data-rich tool anyone can use to examine the cardiovascular disease burden in communities across the United States. For those who receive funding from CDC's Division for Heart Disease and Stroke Prevention, the maps in the Atlas can be used to support your work. In this presentation, we will walk through examples of how you can use the Atlas to address stroke and proximity to stroke centers in your communities. For an overview of the Atlas or step-by-step instructions, go to www.cdc.gov and search Atlas of Heart Disease and Stroke. The Atlas provides easy access to a wide range of high-quality local-level data. For this example, we'll be using data on stroke mortality, stroke hospitalizations and discharge, self-reported stroke prevalence, that is, adults who have been told by a health professional that they had a stroke centers, federally qualified health centers, rural-urban status, telehealth stroke care, stroke rehabilitation, risk factors, and community characteristics. Let's start by mapping stroke mortality at the county level. In the Atlas, you can map all stroke mortality, and you also have the option to map specifically ischemic or hemorrhagic stroke mortality rates. Counties with the lowest mortality are in light pink, and counties with the highest mortality are in dark purple. We can see that there are some similar patterns overall, such as low mortality around the northwest portion of the state. We can also see where patterns differ by type of stroke. We can also map stroke hospitalizations. Similar to stroke mortality, we can look at this by overall stroke hospitalizations and specifically ischemic or hemorrhagic stroke hospitalizations. As you create more maps, you may continue to notice patterns that inform your work. The Atlas has a multitude of stroke hospitalization discharge data that can be mapped. Here we see county-level maps of stroke hospitalization discharges home and to skilled nursing facilities. The full list of options for mapping stroke hospitalization discharge status in the Atlas includes those discharged home, discharged to a skilled nursing facility, discharged to another healthcare facility, patients who died before discharge, and other discharge. It could also be useful to map stroke prevalence as shown here. Comparing county-level and census tract-level stroke prevalence can help identify more specifically which areas have the highest and lowest stroke burden. In this example, we see that there is higher stroke prevalence in the eastern and southeastern regions of the state. You can easily overlay the locations of stroke centers when using the Atlas. These maps show a variety of stroke center types throughout the state: acute stroke-ready hospitals, primary stroke centers, primary plus and thrombectomy-capable stroke centers, and comprehensive stroke centers. We can see from these maps that there are some areas with the highest stroke prevalence that do not have stroke centers in their jurisdiction. Before we compare more maps, it's important to note that maps from the Atlas of Heart Disease and Stroke provide important contextual information but do not indicate causation. Rather than drawing conclusions about relationships, we can use these maps to understand the characteristics of communities with varying stroke burden and proximity to stroke centers. This context informs program decisions that are tailored to the needs of each community. Now let's start to understand the context surrounding stroke and proximity to stroke centers with additional maps. Next, we've used the Atlas to make maps of stroke prevalence and federally qualified health centers. This can give insight into where preventive health services are most needed and some of the resources available in that county or census tract. Similarly, we can compare maps of rural-urban status and stroke hospitalizations to get a sense of the rural-urban status among counties with high or low stroke hospitalization rates. In this example, we see that some of the counties with the highest prevalence of stroke tend to be more rural. These maps also have overlays for additional detail. This map of rural-urban status also shows stroke centers, and our stroke hospitalizations map shows hospitals offering telehealth stroke care. This can aid in understanding where people may be able to go for stroke care. Stroke patients may need stroke rehabilitation to support their recovery. This map shows the percent of stroke patients discharged home, along with hospitals offering stroke rehabilitation. This could be useful in determining where interventions may be helpful. In this example, we can see that one of the hospitals offering stroke rehabilitation in this state is doing so in a county with a high percentage of patients discharged home. The Atlas includes data on various risk factors for stroke, such as diabetes. Here we can see the locations of counties and census tracts with the highest prevalence of diabetes. With the atlas, it is also possible to look at a range of community characteristics that can be useful when tailoring stroke prevention and treatment programs to the needs of specific communities. These maps focus on educational levels, displaying the percentage of people without a high school diploma by counties and census tracts. The atlas has numerous features you can use to make and share data and maps. Once you have created the maps you want, you can create a link to share each map, download your maps as PDFs, download the data used to make the maps, create downloadable county profiles, and view the data in table form. To recap, using the atlas, we made maps showing stroke mortality, stroke hospitalizations and discharge, stroke prevalence, locations of stroke centers and federally qualified health centers, rural-urban status, telehealth stroke care, stroke rehabilitation, risk factors, and community characteristics. With these maps, you can document geographic differences, enhance partnerships, and tailor program planning to the needs of communities. Thank you for watching. You can find the Atlas of Heart Disease and Stroke and instructions on how to use the atlas by visiting www.cdc.gov and searching Atlas of Heart Disease and Stroke.